So, good morning, everyone, and thank you for joining us at the launch webinar for our competition 23, which will be focused on child health. My name is Caterina Lombardo, and I work for the SBRI Healthcare PMO. And I promise you I'm not in a cave today, but there is a lot of light in my room, so bear with me if I look dark at times. I will be your host today, but I won't be on my own. I will be supported by a number of brilliant speakers that are joining me. And if we go to the next slide, please, Amy, I will tell you who they are. We will have Francesca from the SBRI Healthcare PMO that will talk about what SBRI Healthcare is and what is this phase 1 competition that we're launching. Then Professor Paul Dimitri is going to go into the details about what are the challenges in child health that we would like to address. There will be a Q&A session, and then we will welcome Helen Hoyland from the HSN network that will talk about the support that they can provide. Carolina Bell from Neurovert, who will talk about their experience with SBRI Healthcare as awardees. Then Luis from the PMO will talk about the application process, and there will be another opportunity for you to ask questions. So it's quite a packed agenda, lots to cover. And if we go to the next slide, I can already answer one of the questions in the Q&A box that yes, this webinar is recorded. Slides and recording will be shared in due course in the next few days. However, I encourage you to stay on because you will have an opportunity to ask questions to our speakers that you would miss otherwise. And on this, I just want to ask you the courtesy of ask your questions using the Q&A box at the bottom of your screen, because I won't be looking at the chat. I will only be looking at the Q&A box, so I will miss your question if you ask in the chat. Instead, the chat can be used if you have any technical issues, so that will be monitored by our technical team. One last thing is that we might not be able to address all your questions today, but there will be other opportunities to contact us, not only through our inbox, but also later on. I will tell you more at the end. But I think without any further ado, I will introduce you the first speaker of the day. So if we can go to the next slide, please. There you go. So Francesca Troiani, as Senior Program Manager in the SBRI PMO, will talk about SBRI Healthcare. Over to you, Fra.
Good morning, everybody. My name is Francesca Troiani, as Kate mentioned, and I will be giving you some information about the SBRI initiative, the SBRI Healthcare Program. May I have the next slide, please? So first of all, SBRI stands for Small Business Research Initiative, and it is a pan-government structured process that enables the public sector to engage with innovative suppliers. It is funded by the Accelerated Access Collaborative, and it is currently managed by the LGC Group. It is also supported by the Academic Health Science Network. So SBRI has 4 main objectives. The first one being to improve patient care, to increase efficiency in the NHS, to enable the NHS to access new innovations that they wouldn't be usually accessible to them. And last but not least, to help the UK and increase their economic growth. May I have the next slide, please? So SBRI has 3 different phases that span anything from translational development up to implementation, adoption, and spread. So in this moment, in this talk, we will be talking about specifically phase 1 and a little bit about phase 2. So translational development, clinical evaluation. May I have the next slide, please? So what does differentiate SBRI from all of the other funding programs out there? So first of all, SBRI is a source of 100% funding for small and medium enterprises. It is a risk-oriented program. We aim to provide you with a simple application form and a quick turnaround in order for you to start building your innovation as soon as possible. And we are supported, as I mentioned earlier, by the HSN network. May I have the next slide, please? So there are 15 HSN in England, each of them covering a specific part of the country, and apologies. And they can all support you with bringing your innovation to life. And Helen later will give you a little bit more information on how they can do that. May I have the next slide, please? A little bit more about SBRI. So first of all, SBRI is a themed competition. Now, this means that every year we have a different competition on a different specific theme. That theme is chosen with NHS England and according to their challenges and priorities for the year. The SBRI program is particularly suited for small and medium enterprises, but any size of business is eligible as long as there is a clear route to market. That is very important. And as long as they're based anywhere in Europe. As I mentioned earlier, we will be talking specifically about phase 1 at the moment. So phase 1 are feasibility projects that last 6 months and are up to £100,000. And then for the awardees that have been successful at phase 1 and subject to budget, we might run a phase 2 competition where the awardees at phase 1 would be able to apply and might receive further up to £800,000 for 12 more months. May I have the next slide, please? So depending on your entry point and your project plan, because obviously we are aware that there are different entry points for each innovation, and we don't expect each of the innovation to be market ready already. We see different exit points at the end of both phase 1 and phase 2. So as I mentioned earlier, phase 1 is a feasibility project. So we aim to see for you to establish the feasibility of the proposed technology. And then there are some other things that we've seen in the past, and we might see some examples. For example, market validation, or a business plan, or data identification of clinical partners. Now, these are just examples. There might be more possible exit points. You will be able to find more information on our challenge brief as well. And all of these exit points for phase 1 will be the entry point for a phase 2 project. That would be more of a technical development project. So at the end of phase 2, we might be able to see things like a minimal viable product developed, a health economics study, or the plans for the next stream of funding identified. May I have the next slide, please? So up to now, we have supported more than 300 innovations and invested more than £140 million. May I have the next slide, please? And as you might see, while we have invested about £100 million, all of our companies have leveraged almost £700 million in private investments. So that means that for each pound that we've put into the companies that we fund, they have received almost £7 back from private investments. So we have funded 92 companies that have commercial revenue they've generated more than £70 million of revenue. Of these companies, 79 have sold their innovation to the NHS. And you can see there are a lot more data that we've collected in this slide. May I have the next slide, please? So in terms of portfolio, here you can see a little snapshot of 2 companies that we funded in the past. One of them was Innovus, that has developed a laparoscopic training platform. And this is a really good example of how innovations can bring savings to the NHS, as Innovus has done a health economics study that suggested that their technology can result in more than £100 million per year of savings to the NHS because of the reduction in time for surgeries. iPlato is another company that we funded and is a really good example of how you can integrate your innovation into the NHS. So they have brought their innovation, and it has been commissioned by 45 CCGs, and they have also now merged with Huma Therapeutics that has raised $250 million. May I have the next slide, please? So we also received a lot of good feedback from our companies. You can see here what Good Boost and Therapy Box have said about us. We collect all feedback, it being good and bad, because it helps us improve the program. So you will, if you're successful, you would be asked to provide us with some feedback. Sorry again. For us to improve what we can in the program. May I have the next slide, please? So how do we support you during your journey into bringing your innovation to market? So first of all, we run some pre-competition events. This is the first one. It's a launch webinar in which we will be discussing, as I've just done, the SBRI program, and there would be more information on the specific theme of this competition and some discussion by the HSN later, as Katrina mentioned earlier. We will be running some drop-in sessions and clinics later during the submission window for you to drop in and ask some questions about your application. While you are working on your project, you will have access to the NICE Meta tool through our program. And in the past, we've run some webinars on patient and public involvement, what it is and how to improve it, on commercialization, and towards the end of the phase 1 project, if we can run a phase 2, we will run a workshop on how to write a good application. However, our support does not end at the end of the project. You will still be part of our portfolio, and as our alumni, you will have access to further support. In the past, we have run events like investment readiness programs or peer-to-peer support and a series of other webinars. You will also have access to our showcase events, and you will have the opportunity to introduce your innovation to our stakeholders. So as you can see in the slides, there have been a lot of organizations involved in our program, and we wouldn't be able to deliver any of our funding and any of our support and program without their help. We also collect data in terms of an annual survey that will be used to write an annual report and a case study and some case studies that we will be sharing on our website to give our program more publicity and more views. May I have the next slide, please? So the competition that we're launching today is competition 23 on child health, and we will be focusing on two specific challenges: long-term conditions, focusing on asthma, epilepsy, and diabetes, and prevention of ill health, focusing on obesity and oral health. Before I hand it over to Professor Dimitri, I just would like to go quickly through the timeline of this competition. So as I mentioned, we have just launched it this morning. We will be closing it on the 13th of September. The selection panel will be held on the 12th of December, and we aim for all the projects to start on the 1st of February 2024. In this slide that will be shared after the meeting, you will be able to click on the link and access our competition page, where you can find more information, our challenge brief, a guidance for applicants, FAQs, and anything else that might be of help. And now I will hand it over to Paul to give you some more information on the challenges.
Thanks, Fra. And thank you for this nice introduction and overview. And as Fra said, now we're going to dive into the details of the challenges that we want to address. And Professor Paul Dimitri will be covering this. As you can see from his many designations, I think we couldn't have anybody better to cover this topic today. So over to you, Paul. Thanks for joining.
Thanks very much, Katerina. I hope you can all hear me well. So it's a great pleasure to be here today to speak about some of the challenges in child health, and also really to celebrate the fact that this is the next call of the SBRI competition, because child health is so important. My background is I'm a professor of child health and consultant in paediatric endocrinology at Sheffield Children's Hospital. I also hold a few national roles. I'm the NIHR National Children's Specialty Lead, the Vice President for Science and Research at the Royal College of Paediatrics and Child Health. And I also lead the NIHR Children and Young People MedTech Cooperative, which I'll speak about later in my presentation. Next slide, please. So as I've just said, the focus on child health is hugely important. Actually, children and young people, and that's really up to about the age of 21, make up a third of our population. If you look at children and young people under the age, or 18 years and under, it's 25% of our population. And most importantly, it's 100% of our future. Whatever we do now for children's health will have a lasting effect for the next 100 years. They will be, children and young people will be the workforce of the future, the parents of the future, the carers of the future as well. So it's hugely important that we get their health and healthcare correct now to make a lasting effect in the future, in their adult life, but also on NHS services in the future. But sadly, we have some challenges there. Over 4 million children are still living in poverty in the UK, and nearly 2 million children still have long-standing illnesses. So there is a significant requirement for focus. And there's also a significant impact on our emergency or our urgent and emergency services. And that is blighted by health inequalities as well. So we're having a greater population from the most deprived areas are accessing our urgent and emergency care services. And a quarter of the attendances are accounted for by children and young people, of which many of those have long-term conditions. Next slide, please. And actually, the problems in terms of prevention and what we're seeing today are not new problems. We're not discussing things that have only just started. These problems have been around for many years, and that's exemplified by some of the major documents that have been published over the last 15 years, starting with the Marmot report back in 2008, reporting on significant health inequalities in children and young people. 10 years on, the Marmot review reports that things are worse. They're not better. Health inequalities have got worse, and particularly in ethnic minority groups. Also, the issue of prevention was raised by the Chief Medical Officer back in 2012, Dame Sally Davis, who published a significant and impactful document, Our Children Deserve Better, Prevention Pays, really outlining the need to focus not only on disease, but health care through prevention. So rather than disease care, the focus on health care. And then fast forward to 2019, finally, we see children and young people playing a dominant part in the NHS long-term plan around long-term conditions and around mental health and prevention again. So there has been 15 years and more worth of focus on prevention in children's healthcare that culminates in a really important focus today in the launch of this children's SBRI competition. Next slide, please. And part of the focus within the competition has to be around health inequalities, and these are highlighted by the Core 20+5. So NHS England launched the Core 20+5 back in 2021, and subsequently a bespoke children and young people Core 20+5 was launched in 2022, with a view of reducing health inequalities at the national and system level. And the approach defines a target population cohort with 5 focused clinical areas requiring accelerated improvement, which you can see there, and really form the central parts of our call, or at least 4 of them do: asthma, diabetes, epilepsy, and oral health. And I'll come to obesity in a minute. So the core 20 describes the most deprived 20% of the national population as identified by the National Index of Multiple Deprivation. But for children and young people, remember, there are wider sources of data as well. So that includes the National Child Mortality Database and data available on the Fingertips platform, and also the National Child Measurement Programme related to obesity. Remember, the plus population groups include ethnic minority communities, inclusion health groups, people with learning disabilities and autistic children, coastal communities with pockets of deprivation, sometimes hidden amongst relative affluence, and people with multiple morbidity, and also those with protected characteristics as well. And also, when considering children and young people, think about those who are young carers themselves, and also children and young people who may already be within or in contact with the justice system. And then the 5 is the 5 clinical areas, which I've mentioned before. So that encapsulates the core 20 plus 5. Now, just thinking about that in the context of the 2020 State of Child Health report published by the RCPCH in 2020, data consistently shows that poverty and inequality impact on a child's whole life. That affects their education, their housing, their social environment, and that in turn will impact on their health outcomes as well. And the State of Child Health indicators demonstrate a widening gap between the health of children from the most wealthy and the most deprived backgrounds. Next slide, please. So the SBRI Healthcare Call invites breakthrough innovations to address challenges in child health in 2 key areas: long-term conditions and prevention of ill health. So the first group that I'll cover is long-term conditions: asthma, epilepsy, and diabetes. Next slide, please. So asthma is the most common long-term condition in children and young people in the UK, and it affects around 1.1 million children and young people. And the UK has one of the highest prevalence of emergency admission and death rate for children and young people with asthma in Europe. So that's really quite a challenge, and one that is really disappointing considering we have one of the best healthcare systems in the world. And worse still, the National Review of Asthma Deaths, which was published some time ago in 2014, identified avoidable factors in 65% of asthma deaths in children, young people, and adults, and also suggested that asthma education was lacking. So the Children and Young People's Transformation Programme through NHS England has committed in the NHS long-term plan to improve asthma outcomes for children and young people. And I'd recommend you read the long-term plan because they've developed a national bundle of care for children and young people with asthma to support local systems. To support local systems with the management of asthma care. However, in spite of these initiatives, there remains a significant need to address challenges for children and young people within asthma care. And in particular, and as has been highlighted from that previous slide in the core 20 plus 5, asthma outcomes are worse for children and young people living in the most deprived areas. So the SBRI programme encourages innovations that support the most deprived 20% of the national population. And as you will see from the delegate pack, the applicants pack, that focus on that most deprived 20% of the population runs right the way through the areas of focus: asthma, diabetes, epilepsy, oral health, and obesity. Next slide, please. So now moving on to epilepsy, again, one of the most common major long-term conditions in children and young people, with an estimated 112,000 children and young people suffering with epilepsy in the UK. And sadly, between 40 and 80 children die every year as a result of their epilepsy. And it doesn't matter about 40 to 80, one child death from any long-term condition should be avoided. So we need to focus very hard on how we reduce the death rate, the mortality rate in any of the long-term conditions in children and young people that we look after. And unfortunately, misdiagnosis still remains a major concern for children and young people in epilepsy. Epilepsy is a particularly difficult condition to accurately diagnose, and unlike some conditions, there's not one test by which epilepsy can be diagnosed. And in one study, one of the studies found that up to 40% of children and young people referred to specialist clinics were actually found not to have epilepsy, resulting in unnecessary treatment with anti-epileptic drugs. And on the flip side of that, undertreatment for those with epilepsy is also a significant problem, with estimates of up to 70% of children and young people with epilepsy could be free of seizures if they were appropriately managed. And some of that is underpinned by poor communication between professionals caring for children and young people with epilepsy, and also between professionals and the families that they look after. And those communication issues have been identified as a major contributory factor to challenges of epilepsy care. And so variation in care is and continues to be an issue. In 2020, it was identified that fewer than 1 in 5 children and young people with epilepsy could access certain specialist diagnostic and treatment procedures locally. And that came through the Epilepsy 12 audit published by the Royal College of Paediatrics and Child Health. And actually, again, as you would expect, inequality blights us with challenges. So accessing services further from home might not be feasible for those from the most deprived backgrounds, owing to either financial or logistical barriers. And also remember that 37% of children with epilepsy have a coexisting mental health disorder, and this is a higher prevalence than most other long-term conditions. Next slide, please. So moving on now to diabetes. This is becoming increasingly common in children and young people in the UK, and that you can see that from the statistics over the 4 to 5 year period. So in 2019, there were an estimated 36,000 children in the UK with diabetes under the age of 19. And that has increased from 2015, where there are approximately 31,500. And it's not 100% clear why we're seeing that increase. It may possibly be due to an increase in viral triggers. We're also seeing comorbidities with type 1 diabetes. So it's not just about the disease itself, but the comorbidities that type 1 diabetes brings, both short and long term. We're seeing an increased prevalence of obesity or being overweight in about 40% of cases of children and young people with type 1 diabetes, and nearly 30% of children and young people have levels of blood pressure in the hypertensive range. And often as well, children and young people with diabetes, just like those with epilepsy, need psychological support as well. Diabetes control is worse in children and young people from ethnic minority groups, and this results in a much higher risk of long-term complications. And then when you combine that with the comorbidities, particularly in ethnic minority groups, the incidence of complications goes up further. Some of the long-term complications and the short-term problems with type 1 diabetes may be related to inequitable access to diabetes technologies, which ultimately will improve the control of type 1 diabetes. And also thinking in the context of diabetes is, of course, type 2 diabetes, which we are seeing a much higher prevalence now in children and young people because of the increased incidence of obesity in the pediatric population. And the prevalence of type 2 diabetes is higher in females, again, particularly from those from minority ethnic backgrounds and those from the most deprived areas of England and Wales. And I have no doubt that that is related to the higher prevalence of obesity in these populations. And as you would expect with many other long-term conditions, there is a variation in outcomes in children and young people with type 2 diabetes as there is with type 1 diabetes, and that too requires attention. Okay, next slide, please. So now we move into the area of prevention and ill health. And as I mentioned earlier, this has been highlighted for many years with that significant document that I mentioned earlier. Our children deserve better prevention pays. We need to focus on improving the health as well as the healthcare of children and young people to ensure better health in adult life, and also a significant impact to change the NHS for good. Next slide, please. So sadly, obesity affects nearly 1 in 4 children by the age of 11, according to the National Child's Measurement Programme. And that increase we see actually from from children that are younger. So at reception age, the incidence is around 10%, moving up to 1 in 4 children by the age of 11. There is, as you see in adults, a high risk of future complications, and it would be almost impossible in this short presentation to go into all the long-term complications of obesity. But as you would expect, an increased risk of cardiovascular disease, including coronary vascular disease and stroke, an increased risk of cancer, an increased risk of metabolic complications such as type 2 diabetes, hypertension, polycystic ovarian syndrome, gallbladder disease, liver disease, and so on and so forth. So you can look at all of these online on any reliable website to see the high risk of future complications. But this is costing the NHS significant amounts of money. Approximately £4.2 billion is spent every year on obesity care relating to obesity itself and the comorbidities, and a wider cost to the taxpayer of £27 billion. So it's not only a significant health problem, it's a significant economic problem for the UK. And it's a significant problem in ethnic minority groups, and we're also seeing a much higher prevalence, almost twice the prevalence of obesity in the most deprived areas of the UK. And despite, as such, the government has pledged to halve childhood obesity and significantly reduce the gap in obesity prevalence between children from the most and least deprived areas by 2030. And despite efforts to address this through setup of the complication of excess weight management clinics across the country to manage children with complications from being overweight, the prevalence of obesity in childhood remains high. And this has not changed over the last decade or so. If you look at obesity rates over the last decade, despite the significant investment, there has been little impact on childhood obesity rates over the last 10 years. And so we need to effectively promote healthy living and nutrition from an early age to ensure that we combat childhood obesity. So we need to start early. Despite this, we're up against some societal challenges as well. Children are heavily exposed to television advertising for food and drinks that are high in salt, fat, or sugar. In addition, fast food shops are growing in presence on the high street and increasingly clustering around schools. And I've said at the bottom of the slide there, this is an old problem. It's not new to the UK. It's an old problem over the last couple of decades, but we need new and innovative solutions to tackle this. Next slide, please. So finally, moving on to oral health. Tooth decay is the most common oral disease affecting children and young people in the country, and it's resulting in at least 60,000 days being missed from school during the year for hospital extractions. And yet it is a largely preventable problem by reducing consumption of sugar in food and drink. Children and young people are consuming the equivalent of around 8 sugar cubes more than the recommended daily limit. Children need adequate exposure to fluoride and routine visits to the dentist. And despite this, 46% of children living in England saw a dentist in the 12 months running up until June 2022. And that falls to under 24% of children under 4. And tooth extraction has become the most common procedure in 6 to 10-year-olds. So you can see this is a significant problem, both on a societal basis and a hospital basis as well. And the estimated cost of these hospital admissions for extractions is around about £33 million. And despite the NHS England initiatives to improve oral health of children, data from the Oral Health Survey of 3-year-old children indicates that the numbers experienced dental decay have changed and increased since 2013. And as with the previous diseases and obesity, significant inequalities in oral health continue to exist for children living in the most deprived communities who are experiencing poorer oral health. And ethnicity is also playing a part as well. So in the last 5-year-old dental survey, this showed that children of Chinese and Eastern European origin were at more risk of dental decay. And we are also seeing inequalities exacerbated for those children living with disabilities and vulnerable children. Next slide, please. So I just wanted to finish off by talking about more generally some of the challenges to consider in child health technology development, and also something for you to consider in your applications. The first is about no technology for us without us. That is about including children and young people in developing technologies. That when I lead NIHR at MedTech, we have an ethos of technology designed for children, with children, that everything that we do should be inclusive of children and young people and their families in development and design. We also need to consider the anatomical, physical and social changes that children and young people undergo. And there are vast anatomical changes from birth, so from neonatal years up until teenage years. And we see also significant physiological changes and also social and developmental changes. And that then translates into needing developmentally appropriate technologies to support children and young people as they go from being neonates, infants and toddlers right the way through to adolescence. So versatility in technology developed for children is key. Embedded with that is also the issue of autonomy. So think about the users of technology. For children in their younger years, the users are likely to be families and caregivers, whereas in later childhood life, in other words, adolescence, it is likely to be children, the young person that is the user. So they become more autonomous in the use of those technologies. There's also the challenge of longevity. Many of these children and young people will be using the types of technologies that you're developing for long periods of time. So what we need to consider is how we prevent attrition. In other words, how do we support them in continuing to use those technologies, and how do we adapt them in a way that we prevent them from losing interest? I'm also a great believer in personalization, that we need to avoid the one-size-fits-all approach, that not every technology that we develop should be considered appropriate for all children and young people, that we need to think about how we personalize what we do with those technologies to fit the needs of the children and young people that we look after. And then finally, just a consideration about the interface between physical and mental health, because as I've highlighted earlier, many of the children and young people that we look after with long-term conditions, with obesity, and also with poor oral health will also have mental health issues as well, right the way from those that will have relatively minor mental health issues through to those with depression and anxiety that need additional help from healthcare services. Next slide, please. So just to sum up, I also wanted to talk a little bit about the support that will be available to you. And this is by no means a comprehensive view of the support, but just some of the groups and networks that are set up that may be able to help support your applications. So I am director of the Children and Young People MedTech Cooperative, which is one of the 11 MedTech and in vitro diagnostic cooperatives to support the development of health technologies. We have 7 themes within NIHR MedTech, which are listed on the right-hand side there: epilepsy, movement and muscle disorders, neonatal technologies, rare diseases, respiratory, sleep and ventilation, surgical technologies, cancer and transition, which is the movement of children from pediatric to adult healthcare, which is our cross-cutting theme. And so you can see that some of the areas of focus from the SBRI healthcare call relate to some of the themes that we support in NIHR MedTech. And you can see our web address if you want to access more information at the bottom of the slide there. Next slide, please. And there are also groups and organizations set up to support child health technology development. So Alder Hey have the Innovation Hub. There's the Drive innovation team at Great Ormond Street Hospital that supports work around artificial intelligence and data analytics. They both have an excellent track record in the field. There's also the Academic Health Science Network, which you'll hear much more about in later presentations. And also just to say that children's specialties, there's also the Child Health Alliance, which links 15 NHS trusts across the country support work in children's health, but also pediatric subspecialties are remarkably well networked and supported through NIHR and also the Royal College of Paediatrics and Child Health. So there are significant areas of support to help you with your application. Next slide, please. And then just finally, the National Centre for Child Health Technology, which will be built and due to open its doors in 2025. This will be built in Sheffield on the Sheffield Olympic Legacy Park, and it has what we call the Super 7 strategic priorities. And they again align with the SBRI healthcare call around prevention and health inequalities, childhood obesity, mental health, long-term conditions, maternal and child health, disabilities, cancer and cancer prevention. This is a significant step forward for the development of child health technology. This is a £22 million, 42,000 square foot centre at the Sheffield Olympic Legacy Park that will bring industry, academics and the universities, healthcare professionals, and most importantly, children and young people to the centre to support the development of child health technology from unmet need, proof of concept, right the way through to development of those technologies and acceleration of those technologies into the NHS with deployment and spread of the best technology to support the health and healthcare of children and young people. Next slide, please. So this is my final slide, which is to leave you with the message of start early, change more. Remember, as I said at the beginning, what we do now in terms of developing child health technology to support the health and healthcare of children and young people will have a lasting effect for the next century. It is absolutely vital that we start early to change the NHS and the health of our population right the way from childhood to make sure that we have sustainable health and healthcare over the next 100 years. Thank you very much.
Thank you, Paul, for this very insightful overview of the problem. And if I can call also Francesca to come on camera. And now it's time for some Q&A. I see that your presentations have stimulated already lots of comments in the chat, also about how the government could address some of these issues. And questions for you, Paul, in particular. And just to say to the audience, Paul can only stay with us until 10:30. So please make sure that you ask questions for Paul now, so you can take the opportunity for him to answer them. And if that's okay, I will start with the first one from Michael, who was saying, would an innovative means of taxation on sugar be in scope if it were balanced by a reduction in national insurance? What he meant, it was more an app-based shopping guide with discounts on product without added sugars. What's your feeling about that, Paul? How would that meet this brief?
Yeah, it's an interesting one. I think, we do need innovative solutions to reduce the prevalence of obesity in the population. And as is really implied within that question, that this is a societal problem. I think it has fallen very much on healthcare professionals to try and sort out obesity, but I think we need to look at the wider determinants of obesity within children and young people. So I think it's important to consider, other areas in which we can make change to ensure that that it has an impact on children and young people in a way that improves nutrition and improves physical activity. So I would say yes. I think something that has an impact, a wider societal impact on children and young people is going to be hugely important. What we've got to be mindful of course, is this has to align with what we're doing in the NHS as well. So I think in some way we have to link in whatever innovative solutions have been developed with what we're trying to deliver in healthcare as well. And remember, within the call, there is a need to bring in clinical partners. So I think that clinical collaboration is going to be hugely important in how we address some of the societal issues as well. So I think these sort of things should be in scope. We should consider them, but I think there just has to be a time with what's happening within the NHS.
Thank you, Paul. And actually, following on that, there was another interesting question from Alan regarding the obesity theme in particular. If we are looking to support the children, or would also we welcome support to the families?
Oh, absolutely. So yeah, that I think is an absolute given. And of course, mentioned in that slide about versatility is of course that families are integral to what happens in terms of the care of children and young people. So technologies absolutely need to include families and also consider siblings as well, because some of the work that we've been doing in NHR SIP MedTech involves or includes siblings as well, and the impact on siblings for children and young people with long-term conditions. So yeah, families must be included in this. I mean, this is, you know, this is a fundamental part of developing child health technology. But I go back to that point about versatility. Is remember that children will gain more independence as they go through adolescence. So that versatility is going to be hugely important on how you aim your technology. So you may decide to aim it at a specific patient age range, which would be more inclusive of families, but you may decide to do something that would be that would require the more autonomous use of young people in sort of mid to late adolescence. So I think there is a balance there, but families absolutely must be considered within the context of developing technologies for children and young people.
Yeah, no, thank you. Yeah, it's a whole problem. It's not just an individual problem, right, to address. So no, thank you for clarifying that. And actually, there is a question that I'm also going to bounce to Francesca to put some context, and to you, Paul, as well. Ewan was asking if their technology has potential to impact multiple key areas and chronic conditions specifically within the scope. And they were wondering if it would be smart for them to make this part of their bid, or if they should narrow down.
Sorry, I missed the question there, Katharina. Apologies.
So these innovators, they have a technology that touches a lot of the chronic areas described. And so they were wondering if they should narrow down the focus of their application, or if they could apply touching different areas within their application.
So it's not within my gift to tell applicants what to do, because I think, you know, there are some technologies that will have broad impact on multiple long-term conditions, and others that will be quite specific to the long-term condition itself. But I think there is no doubt that there are generic issues that cut across long-term conditions. So some of the work that I've been leading on in NHR SIP MedTech, which is specifically around one long-term condition, which is type 1 diabetes, that actually the issues that have come up are relatively generic across multiple long-term conditions. And this is around the area of transition. So, you know, things such as sexual health, the use of alcohol, you know, access to GP practices, access to medication, etc. So I can't dictate what applicants wish to do, but I think it's important to recognize that there are generic issues and subsequently potential technologies that would support children and young people with different long-term conditions. And of course, the value of that is that you reach more children and young people, that, you know, you reach a bigger population. So I think that would be reasonable to look at. But as I say, it's not within my gift to tell people.
Of course. And I think on this note, Francesca, do you want to add something from the SBRI and the application angle side of things?
Yes. So when you submit your application, you will be asked which specific sub-challenge you are applying for. So you should probably choose the one that meets that targets your intervention the most. You're welcome to mention in your application that this can be applied to different challenges as well. However, I would also like you to keep in mind that this is a 6 months project, so you need to be you need to consider what can be feasible over this 6 months and not try to overcommit to doing something.
Thank you. Yeah, absolutely. So you'll need to pick a theme, but doesn't mean that you can make the argument for others if you think it's relevant to more than one. Thank you both. And I guess there is another question about if you could please, Paul, maybe expand on the type of diabetes devices innovations in focus.
Sorry, the question was...
Could you please expand on the type of diabetes device innovations that are in focus for this?
So the answer is that, I mean, you know, it can be a digital-based platform, could be an app-based technology, could be a specific device. If you read the competition brief, there are some indicators as to the sort of devices or technologies that could be applicable to this application. But, you know, I think innovative solutions devices, digital-based platforms, app-based technologies all fall within scope. So I can't be very specific about the device, but
Yeah.
if it qualifies as being a technology or a digital solution, yeah, I think it would qualify for the scope.
And that's a very actually good segue. Alan was asking because when we speak, we mention a lot technology, but actually I want to clarify that we find innovation in the broader sense of term. So normally, yeah, as a medical device or an in vitro diagnostic when applicable, or a digital technology, but any innovative approach could be considered. There is nothing specifically excluded from the SBRI scope. So I hope that that clarifies. Also, Paul, we had some challenges from the audience. I was wondering if you wouldn't mind to maybe comment on them. We have, for example, why eating disorders weren't part of the briefing, or another comment was, you mentioned, these issues are not new, so why hasn't been done something before about them? What I want to clarify is that obviously there are lots of problems that we can address through SBRI Healthcare. We need to pick a focus. Doesn't mean that there won't be any other competitions in the future that will be more specific for example, eating disorders or the problems highlighted. The fact that we're focusing on something doesn't mean that we're neglecting that there are other important issues to address. But do you mind to maybe comment on the fact these issues are not new? So why haven't we managed to find a solution? What did we fail so far?
Yeah, so it's a good question. Maybe just coming back to the eating disorders question first. I mean, there are lots of different areas of child health that an SBRI healthcare competition could focus on. And, with my background, of course, I would be supportive of any of those because, I go back to the principle of, starting early, change more. Whatever we can focus on in children and young people has the potential to have an impact long term. It would be difficult. I guess it comes back to that issue of children are not, we're not talking about a specific disease when we talk about child health or child healthcare. We're talking about a population of children and young people where there are multiple different areas. And so, as you said, Katarina, it's difficult to be too broad with the focus because actually it's a huge population with multiple different health and healthcare issues. So the specific reason for focusing on the areas that have been highlighted in this call relate to the core 20+5, the need to bring in a focus on health inequalities within that core 20+5, of which 4 of the 5 are included in that call, and children's mental health has been included in previous SBRI healthcare calls. So actually all 5 will or have been covered, and they also fall within the NHS long-term plan as well. So there is a strategic focus there as well. But one would hope that child health areas of focus will be part of the SBRI healthcare competitions in the future. Why have we not got it right before? That's a really good question. I mean, in some of these areas, billions of pounds have been invested with little change. I don't know why we haven't. I suspect one of the answers, if we take obesity as an example, is that there are wider societal issues, and the biggest challenge around health inequalities, that this is not simply a problem of healthcare or a problem of how we deliver healthcare. It's a societal problem around education, around access to nutrition, around social deprivation, and so on and so forth. So I think these are challenging problems because they're not simply just healthcare problems. There are issues around mental health care, around wider societal support, around family support, and so on and so forth. We need to be innovative, and I'm not suggesting that we're necessarily going to get it right as we move forward. What I am suggesting is that we have to think differently in how we approach these problems to find new solutions. So we've got to get these right. Otherwise, we really are in trouble over the next 50 years as to what our population is going to look like.
Thank you. And this is echoing some comments from the audience as well about lobbying the government to put more pressure on regulation on quality of foods and supplies in the supermarket. I mean, I think we all share that this is not technology only or innovation only approach, but it's a societal problem that involves also the government. And I'll give you a break, Paul, because I wanted to pass a question to Francesca, which was asked about, we received some questions actually in the last few days already. One in particular was focused on net zero. How these innovators mentioned that they have an innovation that could actually also address the net zero agenda, but at the moment they don't have big evidence to propose at the innovation stage. So how would you suggest, Fra, that they could approach this when they put together the application?
So we don't expect you to have already a developed net zero plan. We don't expect you to already have evidence. We know that most of our applicants are small companies, so this is something that comes with time. We welcome any kind of thought that has been put into how to improve, how to get to our net zero commitment. So there will be a section on net zero in the application where you can mention anything that you've done up to now or you believe you will be able to do in the future, but not having a developed net zero plan is definitely not going to be penalized in the application. Having a good one might be considered a plus, but there's no need to have a developed plan.
Yeah, and I would go net zero in the next few years, so no innovations that haven't considered this will be purchased. So this is an opportunity for you to actually develop some evidence towards that commitment and show that this is something that is part of your development plan. Thank you, Francesca. And Paul, I think I have another couple for you. I'll try to squeeze the last 3 minutes out of your time. There was a question asking if the technology to be used to manage the acute situations of epilepsy, asthma, and type 1 diabetes will be included in the scope for the call. I guess it's an easy answer, this one.
Yeah, I think yes is the answer. I think that's a pretty straightforward answer. Yes.
Yeah, so nothing to add, I think, to clarify this better. And instead, there is another one that might be a bit more challenging, and looking at coupling improved safety net provision of emergency respiratory conditions with the support for enhanced long-term management of asthma. Funding would aim to recruit clinical partner, but would a clinical partner not also be essential for the submission? I think that's probably, I can start answering that to say that definitely if the point of the phase 1 project is to develop clinical evidence, we would expect, because the strength of your innovation depends also on the deliverability of your plan. You have 6 months, and it would be good to have everyone in place to deliver the 6 months plan. However, if your plan is to do the clinical work of phase 2, you can use the phase 1 period to build your partnerships. So it's not necessarily a yes or no answer. But definitely the clinical input will be key also in the design of the intervention. So Paul, do you have anything to add on that?
No, not too much to add. I think you've highlighted the point, which is actually if clinical input is fundamental in the phase 1 application, then I would bring in a clinician on board. I think I go back to the point about access to clinical networks. There are lots. There are significant networks set up in a number of these areas. So I would get clinical advice as early as possible. And if you can bring a clinician on board, I would say broadly a healthcare professional. It may not be a doctor. It may be, someone that works in a different part of the health service that would be a good partner to bring in. But as soon as you can, if you see it relevant to bring in a healthcare professional or clinical advice early, I would do so.
Thank you. And I think, bang on time, we can conclude this Q&A session with a statement from Michael Phillips that said, excellent session. Thank you, Dimitri. So I thank you as well for your time, and thanks, Francesca, also for stepping in. Thank you.
Great. Thank you very much.
Thank you. So if we can move on to the next slide, please. because we will move to the second part of the session when we're gonna invite some other great guest speakers to share their experience and also how they can support you. And the next is Helen Hoyland, who's gonna talk about the HSN network and the role in supporting you. So over to you, Helen. Thank you for joining.
Thanks, and hi everyone. So I'm Helen, I'm Head of Digital Commercial and Growth at Yorkshire and Humber AHSN, but here today to talk on behalf of the wider AHSN network across England. So thanks to everybody for today. Next slide, please. Thanks. So as you heard earlier, there are 15 academic health science networks across England, and you can see them all there mapped by region. I would suggest to everyone, if you have time, to nip onto the HSN network website today. There are some really good resources there to get you started. There are innovation podcasts. There is a new real-world evidence and evaluation guide that was published relatively recently, which you can see at the bottom there, which may be of note. And there's things like newsletters and funding bulletins as well. So there's lots of general resources to get you started. But we're really pleased to be supporting SBRI. So we would encourage you to get in touch with your local AHSN, and we can support you really pre, during and post your SBRI journey. You may have heard that in the autumn, AHSNs are going to be rebranded to be called Health Innovation Networks. So just to flag that up, but there'll be no tangible difference or change in terms of the services and the offer that we make to innovators as we move into the later stages of the year. Next slide, please. Thank you. So we're a connected network of networks. We provide support to innovators and entrepreneurs and SMEs. We help you to navigate the NHS, and we can signpost you to lots of regional and national resources and partners within the NHS ecosystem. You can see our broad offer there. So we help with evaluating real world evidence. We can help with things like health economics and business cases. And really, whatever stage of you're at with your company or your innovation, we can help you and give bespoke advice, tailored guidance, and link you into potential regional partners, be those academic or the NHS or care, where there's a sort of an articulated need within each of our respective regions. And we are really linked into the wider health and social care and innovation ecosystem at a regional, national level that you can see there. So I won't go through all of those sort of partners and strategic partners verbatim, but these will all be available later on when you receive the slides. Next slide, please. Thank you. So more broadly, our role is obviously around improving health and improving outcomes, helping around efficiency and quality, economic growth across our regions. So we work across that broad sort of health, economic growth agenda. Next slide, please. Thank you. So we can help innovators across all the different stages really of the innovation pathway. And you can see that SBRI is really front and center of that. So a lot of what we do can help you as an innovator get ready, get prepared for your SBRI application, to be thinking about potentially what some of your NHS partners or clinical partners may be, to look at your evidence, your commercial roadmap, and then thinking further ahead into the future around what will your sort of wider scale and adoption strategy look like, and your route into market in terms of things around procurement, information governance, regulatory, and all of those things that we associate with the adoption of innovation. Next slide, please. So more broadly, we work, as I've mentioned, with our respective NHS and social care partners regionally and nationally to understand what their needs are, and then try and marry those needs up with innovators such as yourselves who are bringing new ideas and technologies to market. We can share examples of best practice and help with benefits realisation. So we're very much connected as a network of 15, and we do share ideas across. Next slide, please. So in terms of how we can practically support you, so you can get in touch with your local AHSN, details are available on the website, or you're more than welcome to come and talk to us in Yorkshire and Humber, and I think my email address will be shown on a slide in a moment. So we can help you understand what the local and national and regional healthcare priorities are and what some of the needs are, you know, in terms of what's happening with your integrated care system, for example. There is some variation, obviously, in terms of need. So we help you to sort of navigate that at a footprint level. We understand sort of the market, so, you know, in different clinical and technological areas, we understand what some of the emerging innovations are and where there may be some gaps and unmet needs. We can help with stakeholder engagement and bringing people together to have conversations around alignment. We can support the review and development of your product, including, really importantly, the evidence base and understanding and scoping through the regulatory environment. As I mentioned, we can look at your early sort of commercialization plans or business models and think about the longer term in terms of what the opportunities for spread and scale might be. Next slide, please. Thank you. So that's our offer, really. So we can help with your application. We can look at, give advice and guidance around that, competitor awareness, support maybe with securing partners for your application. Also, really importantly, we encourage you to think around what might be the impact, obviously, of your particular technology or solution or your SBRI application around the impact on health inequalities and narrowing the inequalities gap. And also advice and guidance around patient engagement and involving patients and end users in the development of your technology or your innovation, which is hugely important. And we can also give high-level advice and guidance around health economic analysis as well. So things like the impact on cost and saving and outcomes for your particular technology or solution. Next slide, please. Thank you. So that was a high-level sort of overview of the AHSNs. My email address is at the bottom there. Please do reach out. We can also signpost and triage you, or you can go directly to your local AHSN, and that's all available on our central website. Thank you.
Thanks, Helen. And also just to flag that on the chat, Lindsay is also added the contact details of the Innovations Agency in our West Coast. So yeah, please do reach out to the HSN network. It was a very insightful presentation. And now if we move on to the next speaker, we'll now have Carolina Bell from Neurovirt. She's the co-founder. So Carolina, if you can go on camera now, please. We wanted to share with you. Are you okay?
Yeah, it says that the host has stopped working.
Oh yeah, let me do that for you then. That should work.
Thank you.
In a minute. There you are. So I just wanted to say Carolina has been through the motion with us. She's been through the journey. Hopefully she will have a lot of nice things to say about SBRI, but mostly she's here to share her experience and to give you some tips on how to approach this, since she's been through the process like you will be. Thank you, Carolina. This is over to you.
Thanks, Carolina. So hi, everyone. I'm the co-founder and business and finance lead of Neurovirt. We receive grants, and I'm here today to tell you a little bit about my experience, as well as give you some hints and tips on your application as well. Next slide, please.
Yeah, just to say, you need to say next slide. Thank you.
No worries. So just a little bit about Neurovirt before I start. Neurovirt is a medtech solution, and we create games and immersive VR to gamify the rehabilitation process for patients. We quantify their impairment and their improvement by collecting and projecting accurate movement metrics on our web app. And we also provide a means for clinicians to assess and monitor their patients in clinic or remotely. So we found that with Neurovirt, clinicians can provide 14 times more therapy at just 20% of the costs of the current care. Next slide, please. So we received the SBRI Phase 1 award in 2021, and it was for a 6-month project. At the time of the grant, our solution was a TRL3, and we had already co-designed a proof of concept with 11 clinicians.
Carolina, you are cutting out a little bit, so now we can't hear you anymore. I just wonder if you stop your video, it might be better. Shall we try? Let's give Carolina a minute. Otherwise, I might ask her to reconnect. Try now?
Can you hear me now?
Yes, very well. So you were saying about TRL3 and then we lost you there. Thank you.
No worries. So our technology was a TRL3 at the time that we applied for the SBRI phase 1. We had already co-designed a proof of concept with 11 clinicians specialized in stroke rehabilitation. And we received feedback on our game design through questionnaires from 11 patients with upper limb impairments. We had also used this feedback to create 3 games, which we trialed with 10 of the patients prior to the commencement of the grant. And this was important both for us, but I also believe for our funders to have illustrated the viability and the market need when we applied for the SBRI. So during the grant project, we collaborated with experts in the field. We were actually lucky that one of our consultants is a key opinion leader in stroke rehabilitation. And we also collaborated with a team of physiotherapists, occupational therapists, and speech and language therapists to conduct reiterative development and test the solution with over 40 stroke survivors. We tested the usability on a standard system usability scale, the tolerance, i.e. whether or not patients had any adverse effects, and also the acceptability of the solution, so whether or not patients like it and whether they would use it. So the SBRI also provided us with access to the NICE meta tool and support from HECO Analytics, which was very useful for us as it provided us with insight into the requirements to enter the NHS, as well as helped us solidify our healthcare economic analysis. Next slide, please. So the hints and tips. So we, the first one is to start early, I would say. Especially if you don't have any grant writing support, it's important to engage with all the partners that you're thinking of working with early on, discuss the project scope, understand their costs, their timelines, and give yourself plenty of time to write the grant, as it needs quite a lot of thought. The second one is more around the timing and the type of the grant you go for. So whether this is the SBRI or not, we have always found that it's important to understand what stage your company is at, what evidence you have generated so far, what are the next steps, and think about whether this matches the grant call and also their timelines. The grant funding is a fantastic way to progress your company quickly, so it's important to sit down and think about what it is that you actually want to achieve. Think about your team and your partners. So who do you have on board? Who do you need? Don't try and cut corners. That's a big one. If you think that bringing extra hands on board will help in the success of the project, this is a really good opportunity to produce good quality work, both in terms of the product, but also the research. So do find the appropriate people to work with you collaboratively on the grant. Also, speak to the HSNs. I know they've already provided a presentation, but they really do support, and there's a varied way in which they can support you. So don't feel shy about reaching out to them. We reached out to our local AHSN, which was UCLP, since we're based in London. Think about the IP. So who does it belong to currently? Do you need to license anything during the project? Have these discussions with your collaborators as well to ensure that the IP is protected, especially if you're working with universities. Consider whether your project needs ethical approval, as it may take a really long time to get it, and 6 months may not be enough. We actually didn't need ethics for the phase 1 project, and we had confirmed this with university ethics boards as well as the MHRA, just to make sure that indeed we didn't require that. So do think about that early on. Think about the healthcare economics of your solution. So I really need to stress how important it is to show that you have a product market fit and how it will be integrated into the healthcare system. We actually didn't have a lot of data available to us for a full economic analysis at the time, but we did use official sources to extract whatever figures we could find, and then use those to calculate some preliminary healthcare calculations, which we had also presented into the SBRI. I would also try to understand what the patient pathways are and also how your solution fits into those patient pathways. Do include your assumptions and your calculations in the SBRI application. I think it's important for your funders to understand how you came about those figures. And it also shows that you've considered the commercial viability of your solution. One thing, if you do get the grant, do take advantage of the support that's provided by the SBRI and HECO Analytics, because spend some time actually, you know, completing the nice framework, because it's extremely useful, and it's not a tool that everyone has access to necessarily easily. Finally, patient and public involvement is very important. So not only does it validate your technology, but we have had, like, as Neurovert, we've had some very, very useful insights that we wouldn't have gained had we not engaged with stroke survivors from the very get-go, as well as their carers. You should have a PPIE plan, and you should detail this in your applications, and try reaching out to charities. We found that the Stroke Association was immensely helpful with PPIE, and sort of helping us engage with both patients and their carers. And PPIE could also include focus groups. It could include technical explorations and discussions. It could include oversight of your project protocol by patients and carers. Generally, it's very wide. So think about what would truly make a difference to your tech, and also refer to the NICE guidelines with regards to their compensation. One of the final points, so take full advantage of the opportunities that is given to you by the SBRI team. We have had an amazing experience with the SBRI. It's been really a very strong project that's gone through. The team are amazing to work with, and they're extremely helpful. So don't be afraid to be open and ask for help when you need it. And that's it for me. So I wish you all the best of luck for your application.
I was on mute. Thank you so much, Carolina, and thanks for the endorsement to the team. Kudos to the PM that supported you in the journey. If you can then now mute yourself and wait on the line, because we have a Q&A session after this presentation, so there might be some questions for you if you're happy to stay. Thank you.
Yeah, of course.
So now we have the last speaker of the day. If we can go to the next slide, please. I'm going to invite Luis to turn his camera on. He's another senior program manager from the SBRI PMO, and he's going to talk about the assessment and how to apply. Thank you, Luis. Over to you.
Thanks, Kate. Good morning, everyone. So I'll be touching on the assessment process and how to apply for our research management system, as Kate mentioned. So first, next slide, please. So as mentioned before, the application process just opened today. So the call is available for you to apply for our system. This is open to everyone, and you will submit a short application form online, which will then be shortlisted by a pool of clinical, technical, and commercial experts and reviewed by the Program Management Office. And up to around 25 applications will be shortlisted into a panel meeting. If you are shortlisted to the next stage, then you will be asked to do a 3-minute video pitch that will be assessed by a panel of clinical, commercial, technical experts, and also patient and public representatives. And then after the phase 1 project, which will be for 6 months and up to 100K, you will then be invited, all of the phase 1 awardees will be invited to then submit a phase 2 project, which will then be up to potentially 100K, although there might be some variation in that amount of funding depending on the funding envelope from the NHS England, and 12 months. Next slide, please. So in terms of the assessment criteria, there are 8 key assessment criteria here, which, as you can see from the slide, they have different weightings between them. And these will address some points around, for example, how will it address the challenge brief, risk and mitigation strategy, the level of innovation and IP management of the product, assessing also the commercialization implementation plans, equity of access, now it's embedded into the project itself, addressing net zero emissions, and also touching on how strong the team is, if they have the right skills and expertise to deliver it, and if the costs have been justified appropriately. Next slide, please. In terms of the application itself on the system, so you will find in our newly revamped website, sbrihealthcare.co.uk, you will find some information there to help you with submitting your application. Our main website there, if you go on the top to competitions, open competitions, and you click on competition 23 child health, you'll find all of the details and files that you require there. Next slide, please. And then you'll see on the left-hand side of the website the timelines that we've already touched upon. So, the competition launched today, this morning. It will close on the 13th of September. Decision panel will be in December, on the 12th. And then all projects will start simultaneously on the 1st of February of 2024. At the bottom of the page there, you will find a link to the guidance for applicants and the portal guidance and FAQs, which we would invite you all to read very carefully. Also in the FAQ page, you will find a video from colleagues of ours in the program management office that will outline in more detail some guidance for you to submit your application. We also invite you to really read carefully our invitation to tender, challenge brief, template application form, finance form, and development agreement, and particular emphasis on the development agreement, and ensure that you are familiar with the terms of the agreement and that all looks good to you, as these are non-negotiable. After reading through this, if you click on the link there at the top, which says application portal login, you will then be taken to our research management system, the RMS, where you will be submitting your application. Next slide, please. So you see here that this is the landing page of the research management system. If you have previously submitted an application, you simply have to log in. If not, then you will need to register. And just one point to note that the registration and the approval of registration is done manually by our RMS team. So this will only happen, this approval will only happen during weekdays from Monday to Friday. So if you submit during the weekend, there may be a delay in getting your registration approved. Next slide, please. Once you log in, this is the homepage that you'll find. If you click on the Manage My Details, you will then be taken to a page to update your CV, to put details about your background, and that will complement your application. And then you'll find also a link there to apply for the current funding round and to submit a new application. Next slide, please. And this will then, if you click to apply to the current round, you will then see a link there, a page where obviously this refers to a previous award, a previous funding call for SBRI, but you will see something with a similar format for the current funding round for child health. Next slide, please. Once you click on that to apply, you will be then taken to this page, which will show the different sections that you can fill in for the application that will be populated into the application form. And you will see a little green tick box there where the question mark currently is on the left-hand side for each of the sections that you have completed. And you will need to complete all of the mandatory sections in order to be able to submit your application. If you would like to, you don't have to complete it all in one go. You can save the progress and return. You see there at the top right-hand corner some boxes saying save and close. And you can use these to fill in the information and return whenever you would like to complete the application, as long as it's within the deadline. Next slide, please. One really important point to note is that if you have any co-applicants, you will need to ask them to register as soon as possible, seeing as you will not be able to include them as co-applicants unless they are registered on the system. And they will then need to approve their participation in the application in order for you to be able to submit the application. So this is quite important because this can be cause delays to the submission, and we will not accept any late submissions beyond the deadline because of this reason. So please ensure that you get in touch with your co-applicants sooner rather than later, that they register on the system, and that they approve their participation. Next slide, please. And this is the page that they will see in order to confirm or reject their participation. So please do get in touch with them during the time that you'll be filling in the details, and to ensure that this is in place as soon as possible. So that's it from my side. If you do have any questions around the application process or around the research management system, please do get in touch with us. Thank you very much.
Thanks, Luis. And if I can ask also, well, Carolina, I don't know if your video is going to work, but Helen and Francesca to come back on camera. We have another Q&A session now. And actually, Helen, remind me until what time we have you on the line, so I'll prioritize the questions for you. There are a few in the chat.
Yes, I'm here for about another 15 minutes.
Okay. Okay, should be okay. So I'll go straight to you then, because there are a couple of questions that probably you can address. Well, one is how much will the HSNs will charge for their service? I guess that there is no straight answer to that, but if you can explain a little bit how that works, please.
Yes, so for an introductory meeting, you'd probably meet with one of the AHSN commercial team. So I head up the commercial team in Yorkshire and Humber. So there's no charge for that service. Obviously, it's dependent upon capacity and availability and being able to organise diaries, but we're more than happy to have an introductory and exploratory conversation with you free of charge. So there's no charge for the broader sort of advice and guidance and signposting that I talked about through the majority of my presentation.
And if I can add to that, if the HSN ends up being a partner in your application, obviously some of the costs can be included as part of your proposal.
Yes, that's slightly different. So if there is an application which is going to go in whereby the HSN may be a formal partner, and so helping doing perhaps some of the delivery or the implementation or the governance or an evaluation. So that's on a case-by-case basis. So there may be some costs there. So I would suggest reaching out to your most local AHSN and having that conversation. But again, that will be tailored in terms of the breadth and the scope of what the ask is really. But for the upfront more general advice, guidance and support, that's all free of charge.
Thank you, Helen. And I think I have another one for you. One of the attendees is asking, is stating that finding a clinical validation partner for their diabetes device, which is AI focused, has been challenging. And they're asking for any guidance or introductions possible. And before you chip in, I also want to flag that there was one of the trusts earlier on that also put their contacts in this Q&A box to partner up with attendees. So have a look at that as well. But Helen, can HSNs help with this?
In principle, yes. So I would suggest to reach out to your local AHSN and make that ask of them. And then ordinarily we'll try our best to reach into our local health and care system and see if there's anybody suitable to partner up. We can't obviously guarantee that. It's on a case-by-case basis. But that is a type of thing that we generally look to support where we can.
And also to add to that, you can refer to the support of also for the National Institute of Health and Care Research infrastructure. Some of them were mentioned by Paul Dimitri early on in terms of organizations that can support you as clinical partners. So have a look at the slides when we share them after this meeting. Thank you. And I have a question for Carolina, if that's okay. Can you tell us what's happened after, and you're still ongoing actually with your SBRI project, but can you tell us a little bit where you're at the moment? What has that brought you?
Yeah, no, the SBRI has been hugely helpful in terms of the progress of the company. So after the SBRI phase 1, we received, we were able to prove some preliminary data that was useful for our certification for on the MHRA. So we are able to sell in the UK now. So we've launched. During the SBRI phase 2, we're undertaking a larger feasibility trial, again with 40 stroke survivors, and we are testing the use of the solution in patients' homes, which is how we are imagining our solution being integrated into the healthcare system. And we're doing that collaboratively with the University of East Anglia, as well as our clinical partners whom we've worked with in phase 1. Obviously, there's other things going on in the background with the project. So like healthcare economics, we've worked more closely with HECO Analytics now. So we've come up with our final figures, showing a cost budget impact and the benefits that the solution brings to the NHS. And we've worked a lot more closely with NHS organizations during this project as well. So it's come very far, and it's been fantastic to receive the SBRI support.
Thanks, Carolina. Thanks for sharing your experience with us. And I Wanted also to ask potentially another question to Helen, because what I want to stress out is that, of course, the competition is focused on child health. This particular competition has a very strong interest in addressing health inequalities. Net zero is another important aspect of what the SBRI commits to address as part of the NHS ambition. So, Helen, can you comment on what specific support can the HSNs provide in terms of addressing health inequalities and the net zero agenda, please?
Yeah, so broadly speaking, and thinking in particular about what we've been doing recently within Yorkshire and Humber HSN. So whenever we meet an entrepreneur or company, an innovator for the first time, and we look through their solution and perhaps their technology, we do talk about and give advice and guidance on those two things. So with health inequalities, it's really understanding about what the impact might be. Is it going to inadvertently exclude any particular patient populations or cohorts, or is it going to make access inadvertently more difficult? Or conversely, is there some sort of provisional data or evidence which is suggesting that actually it's going to make a benefit, so it's going to improve the experience or the outcomes for a particular population, and where you may be able to access data to sort of begin exploring some of that. So we can certainly help with that. And then in regards to net zero, we can talk at a high level around some of the changes that are happening within the NHS procurement landscape, what some of the impacts of that will be. And then we can do signposting to quite a lot of resources and things that we've got around, for example, your carbon footprint, your net zero impact. There's things like carbon calculators as well. So we've got all of those resources available across the network.
Thanks, that's hugely helpful, and also for the audience to know, because I know that maybe not for all the attendees, this might be business as usual, so it's good to know that they can have support for that. And I think I see only another couple of questions that will be specific for the SBRI team. So Jeff was asking if it's better in terms of better partnerships to establish as part of the application, if either to integrate clinical organizations or market validation partners. So I guess, Francesca, do you want to have a stab at answering what's the best approach, if there is a best approach for this?
So if I understand correctly, you want to understand whether it's better to have co-applicants or subcontractors. So in SBRI, we don't have co-applicants, we only have subcontractors. So all of the people you want to bring in your team will be subcontractors. However, the costs, you can add the costs of the subcontractors to your finance form and your application, as long as they are fully justified, and as long as, if you are awarded the funds, you will be able to provide us with a quote, a proper quote that matches the estimate that you've given us in the application, and with then a subcontractor agreement signed.
Thank you, Francesca. Also, just to note that in the chat, contacts for all the array have been shared. They were mentioned also by Paul Dimitri earlier, so take advantage of this offer and note down the contact details. And I think just one last comment from one of the questions that I'm happy to address that. Juliet is asking what is in scope and out of scope in terms of what can spend money on. Really, literally, it's only marketing costs that you cannot request in your bid. However, be mindful that we fund a fair market value, so costs have to be commensurate. We don't expect you to make any profit out of these bids. This is public money, so this is the type of approach that you should take when you apply. Let me see. Yeah, okay, Jeff noted that we use the term co-applicants. They are all defined as subcontractors, to be fair, in the application form. Right, Louis? There is no really choice for any different type of categories in the RMS.
Yes, no, yeah, that's right. I think it's just a bit of a no. It's the way that it's assigned in the system that they call it that way. But that's right. What Kati said, yeah.
Yeah, it's a commercial bid and everyone is defined as subcontractor, but it doesn't really make any difference in terms of the costs and commitment you can request. Okay. I had the feeling that we have answered all the questions that were pending. Take a couple more minutes to note down the email addresses that have been shared for networking. And maybe we can go to the next slide then, please. So drum roll. You will be happy to know that we will also be hosting a new session for you to ask more questions to us after you have digested all the information we shared today. This will be on the 23rd of August. The details will be shortly available for registration on our website. So watch this space, I think either today or tomorrow, you will be able to register and attend this session if you have any specific questions that you want to ask. Otherwise, if we go to the next slide, please. This is just a time to thank you and let you know that also you can reach out to us using our contact email address or phone line, and you can also access all the information related to this call through our website. So I think the only thing left for me is to thank you all for your time today and enjoy a nice rest of the day. Thank you so much for your interest and for joining. Have a good day.